I'm your brother and your friend Steve Oluwatumininu. What's your vision like? In this video session, we are going to categorize this into three, which the first one is testing your distant vision and the near vision. The near vision is the reading part of your vision, and these two will be categorized under visual acuity. Second one, color vision, testing your color vision. And the third one is testing your visual field. Then your visual field is just the circumference of your vision. That is the parameter at which you can see peripherally. That is the total circumference of your vision is regarded as your visual field. Now, before I proceed, please kindly press the subscription button, like and share my video so that you can have access to more of my videos that will be of benefit to you. Thank you. What's your vision like? Now, let's test your vision. The testing the distant vision, each eye are usually tested separately. That is, we don't test the two eyes by opening the two eyes at a time. You close one eye, leave one opened. Then you have to focus at a distance object. Focus at the distance, then note any object that you are able to see. Note the characteristics. Then you open that eye. Close the other one. Then also look at a distance. Note anything that you can see within your field of vision and their characteristics. Then you now try to compare what you see in the right eye with the left eye. If there are differences, definitely one of your eye is already degenerating in its vision. Now, if there are no difference, that doesn't mean that you are free from any eye or visual loss, because in some cases, like in glaucoma, we might be rating your two eyes maybe 80% damage. So if the vision in two eyes are the same, that doesn't mean you are free from visual loss. But at least you should be able to know if you are gradually losing your vision. That's the essence of rough testing or self-examination that we're talking about. In a real sense, it should have been done in the clinic or in the hospital using a Snellen's chart, which is a chart that we use to rate, your vision, how far you can see. That is about distant vision. Now the near vision. Near vision is testing the legibility of your reading, how legible you can read. It should be done in a well-lit environment. Now the normal reading distance is 30 to 32 centimeters, which is just like the length of a ruler. That is, you should be able to hold your book at a distance of 30 to 32 centimeters to your eyes. Anything closer, whenever you bring what you want to read closer to your eyes, is abnormal. That is, you might be suffering from myopia, which is short-sightedness. Or if you have to extend your book very far before you are able to see clearly or before you are comfortable with your reading, is also an abnormality, which means you might be suffering from refractive error, which is either presbyopia or hypermetropia, which you might need glasses to correct to be able to read, properly. Now, testing your color vision. Different colors of different forms are usually presented on a background of another colors. That is, there will be mixture of color on a particular surface or on a background. Now, a particular color, if it is red, green, they will be picking them one by one. Then they will form either a diagram or form a number with a particular color. Then pick other color and represent it with different forms. If you are able to pick a particular color, if you want to test your color red, we now tell you you should be able to trace what the color red is used to represent on that background, on the background of mixture of color. If you are able to do so, it means you are not colorblind to red. Then you test differently, and we do this with the aid of what we call Jaeger's chart or color chart. You can simply download it from your Google and do the same. Self-examine yourself to know whether you are colorblind. Then the third one is the visual field, which I said is just the parameter at which you can see. That is the circumference of your peripheral vision. And usually the visual field is usually 180 degrees, which is half of a cycle, meaning you don't have eyes at the back of your skull. That is, from beside your two ears, then to the side and come to your front is your visual field. I mean half of a cycle. That is, starting right from the side of your two ears to the right, to the left, and come to your front represent your visual field. How can you know whether you are gradually losing your visual field? Is by fixing your eye at a distance or at a point, by not necessarily turning your eyes to the right, to the right or to the left. Fix your eye at the point. Don't turn your eye or your face to the right, to the left. Then you will now hold an object. You can hold two objects in your both hands. Then you can start from your ear, stretch your hand until your two ends are fully stretched. Then you have to raise the object at which you are holding in your two hands. Then by fixing your eye at a point, you should be able to see the two objects that you are holding in your two hands. If you are able to see, it means your peripheral vision is intact. But if you can't see, it means gradually you have been losing your peripheral vision, which are very common in the case of glaucoma, where peripheral vision might have been gradually been degenerating and you won't know until your vision becomes like a tunnel vision. That is, if you want to see anything, it will be as if you are looking through a tunnel, the whole of a tunnel. That's what we call it, tunnel vision. And if you want to look at your legs, you will have to turn your eyes down before you could be able to see your leg, which normally, even by looking at a distance, you should have an idea of where your leg is and how your legs look like. Likewise, by holding the two objects in your two hands, you should be able to see the object which you are holding in your two hands by raising your hands, by not necessarily turning your eyes to the left or to the right. That is your peripheral vision. All these are very, very important. You need to self-examine yourself, test yourself, even by not even going to the hospital, to have a rough idea of your own vision. Why we test each eye separately is because when you open two eyes at a time, they do compensate each other. You know the reason is because when one eye is defective, the other one will compensate the loss effect of the other eye, and that is why each eye are tested separately. A woman has came to the clinic in the past. When we now told her we want to test her visual acuity, we said, "Mama, close your right eye." She did. After examining or testing her visual acuity on the right eye, we said she should open the right and close the other one. It was at that point that she knows she has lost one eye, simply because she has been opening her two eyes to see, and because the two eyes do compensate each other. So it is very, very necessary for us to self-examine ourselves. Test yourself to have a rough idea whether you are gradually losing your vision or not. Test your visual acuity, test your color vision, and as well your visual field. Please, if you benefit from this video, kindly press the subscription button, like and share my videos so that you can have access to more of my video. And the next session, we shall be discussing about the common eye diseases that usually causes blindness. We'll pick them one by one, discuss about them, their possible causes, how to prevent them, the signs and symptoms, how to treat them. Thank you. God bless you.